and a lot of our visitors here. First of all, I must thank. So let's move on and see what we have and what is going on. So, what is actually causing this neurodevelopmental disorder? So, before I go further, let me tell you there are two types of autism, if you might know. One is what we are going to talk about today, and the other one is the parents will create autism in the child. Sybil is smiling, but I'm telling you, this is very important. I'll tell you why. So, coming to the neurodevelopmental disorder, and it affects three things mainly: communication, behavior, and social interaction. The child will not be social, he will not be playing with other kids. There will be failure of communication. The most difficult children to treat are the non-verbal ones, children who cannot talk. And so the ASD has a wide spectrum. You can have a non-verbal autism, you can have a verbal autism, you can have an ASD, which is the most difficult thing to treat. One ASD child in the family can disrupt the whole furniture. So, coming to the inheritance, it has a strong genetic contribution. We know there's little doubt that this is an inherited disorder. Genes are strongly or majorly affecting this disorder. Because you know that when you have, for example, there's one child in the family, there are 20% more chances of having. So, coming to the genetics of autism, so there is little doubt that it is inherited. So the heritability is 70 to 90%. It is the most, in fact, it is the most inherited disorder amongst the neurodevelopmental disorders. I've told you 20% chances will be there. And the important thing is that when you have an identical twin, the chances are 70 to 90%. You know the difference between an identical twin and a parental twin. So the identical twin is when the egg split into two. The same egg splits into two. So the chances are definitely much more, 70 to 90%. But when you have a parental thing where the eggs are different, the chances are much less. So this is about the inheritance of autism. So it is polygenic. So there are hundreds, thousands of genes that are affected. You cannot point out. So it's not a monogenetic, it's polygenetic. And the types of inheritance are variants. And it can also be de novo mutation. You know what de novo mutation is? That the gene does not come from the parents. Gene environment interaction, this is very important. Why does it happen? We still do not know. We know that there is a definite genetic component to the neurodevelopmental disorder called autism, but we still do not know why it happens in certain children. So the thing is, if the child is predisposed to autism neurogenetically, and then the environmental toxins come in, there is a very high chance of him developing the disorder. Siblings, I've just talked about them. Parents may carry silent risk genes. Just talked about them. Autism may occur without family history, the one that I just talked about. So, how do you diagnose? It is not really difficult to diagnose. Now, let me tell you something. It is so important to diagnose a child with autism as early as possible. But do you think it's possible? But do you know you can even diagnose a smart mother who has already had children, not the first child, does know the milestones, and he or she will always know when the child is growing up. The response of the child at 6 months, even that can click. So coming to the treatment, behavioral and developmental therapies. The applied behavior analysis ABA. Now ABA is a very important method of treating them, but there are things against ABA. Some people think that it is a forced procedure and people react and children react. So when you look up the reviews for ABA, they are very controversial. It is supposed to be the best. Then you go to speech and language therapy. I must tell you, when I encounter a child who's non-verbal, I'm so unhappy. I know there's nothing you can do. Speech therapies work, but for example, we are in Pakistan and you are in Rwanda, and you have a speech therapist. Who has trained the speech therapist? To be a speech therapist, the trainer should be very, very good. Where do you get the trainer from? Occupational therapy is important, and social skills are very important. So when you look at a child, he's doing repetitive movements, he's not focusing on the mother or the father, he's not socializing, there's little doubt that he is. I must tell you that autism, which is a strongly inherited disorder, children are struggling. I shunt up and down United States, and I see a lot of children with autism spectrum disorder, especially the ADHDs, the hyperactive children. There's very little you can do. Coming to therapies, to me, the best therapy today, let me tell you, is turmeric. Turmeric is a magical compound. Turmeric is a magical compound. It seems to be working on everything. If you take turmeric every day of the week, I'm telling you, your memory is going to get better. I'm not selling turmeric. I'm telling you. So turmeric and the best thing for ADHD is CBD oil. But who is going to get CBD oil in Rwanda? You have? Do you get? You have CBD oil in Rwanda? But it's not legal. It's not legal. CBD oil is not legal in Rwanda. No, turmeric is simple. Turmeric is simple. But CBD oil is not legal in Rwanda. It's not legal in Morocco. You have it? So Professor Najib is the luckiest of the lot. We have it in Pakistan. It is not legal, but we have it. It is now legal in the United States. It's legal in Spain. It's legal in France. I don't know if it is. It's not. But CBD, I must tell you, CBD oil, good quality CBD oil, are very effective in the hyperactive disorders in children. Thank you.